Hello everyone, you are all welcome to lecture number 1180, and today's topic is the ways how to protect yourself from fainting, and in medical term they call it syncope or transient unconsciousness for few seconds or few minutes. This fainting condition means all of a sudden, spontaneously, if anybody who is getting the first indication that your brain is not receiving oxygen, is not getting enough oxygen, that is the first condition. And second condition, you are having hypoglycemia. Diabetic condition means in your blood enough sugar, that is called glucose, is not there, and your brain is not getting enough glucose. The reason is that your brain cells, they need energy, and to convert the sugar into energy, it needs oxygen for oxidation reaction, to oxidize it, to burn into energy. So oxygen and glucose, they are responsible. First condition is oxygen. Immediately it's sure that it is because of that there is no oxygen. And then the condition is anybody who is generally having low blood pressure, they have the tendency of fainting, because low blood pressure means in number it is called systolic, diastolic. Systolic means maximum 120, like that, and diastolic means there is lower minimum, that is maybe 70, 80. So in that case the arteries where it is beating is there, and that beating is called systolic, and diastolic means when there is rest in between that beat is called diastolic. So if there is problem with systolic blood pressure, there is chance of this fainting, that is syncopic condition, or we call it transient unconsciousness, and it will come just like wave for few seconds, maybe 1 minute, but if it stays for few minutes, then it is emergency. Immediately you have to consult physician, doctor, because it may be related to some other health condition like cardiovascular problem. And here let me add one thing, that most of these people who are fainted, first they get the symptom, and the first symptom is there will be anxiety built up. Once there is anxiety built up, automatically your blood pressure, that is systemic BP, diastolic and systolic, that is systolic BP will be down and enough oxygen will not be reaching. That is the first condition of anxiety. Then you will be having some weakness and some short confusion. Once you feel all these conditions, it is only happening generally when you are in the place where it is crowded, high density of population, and in that condition where you are there, maybe at airport and railway station and bus stand, overcrowded, there will be hypoxia, condition of air. Hypoxia means where oxygen density is less in the air. That hypoxia condition may happen to your body muscles, where there is oxygen level is less in your muscles, in your blood, in your body. That is also you are suffering from hypoxia condition, means oxygen level is low. And for that, it is very important that you should keep always oximeter. Oximeter is a very simple nowadays computer device. By putting your finger inside on a screen, it will give two things. First, your saturation point of oxygen in your red blood cell from 97 to 98. If it is less than 90, it means your blood is not saturated with oxygen. You must consult your doctor, and it will give the pulse rate, your heartbeat. And heartbeat usually it should be between 60 to 100. Mostly it is 76, 75 beat per minute. So that is you will get from that oximeter. And also in that condition, if you are there is chance of fainting, and especially those who are having generally low blood pressure, because there the oxygen percentage, the density of oxygen in the air will be low, and during breath enough oxygen will not be receiving in your blood, and it will not be going to your brain cells. There is chance of fainting. So those people, please avoid overcrowded area, densely populated area, and even some big gathering where lot of crowding is there, sweating is there. Please avoid such area. Be in the open air area. And one more thing, let me add here. You know, your actually lifestyle problem, health condition, mostly it is related to factors are very important. You have to be always oxygenated. Go on checking regularly. Second, your BP should not be low, and if it is low, add sodium chloride. Of course, sodium chloride addition, many doctors, they take it as a negative, but no. If you have low blood pressure, always tendency of low blood pressure, add little more, because the sodium will increase the volume of plasma protein in your blood, and that will increase the blood pressure. And once increasing the blood pressure means systolic BP, it will pump more blood to your brain. This is very important. And also add in your diet potassium rich food, vegetable and fruit like banana, like cauliflower, avocado, or there are many fruit vegetables, they are rich in potassium. So these are all factors. And one more thing let me add here. Those people who are having car, this fainting and transient unconsciousness is noticed in car also, and especially when you are keeping your car in garage. Once you are entering, already your exhaust is releasing lot of carbon dioxide, carbon monoxide, and it is indoor, closed door, it is there, floating. And when you are coming out from the car, you are going to your house, you are closing your this car park, that's a garage where you are parking your car. And when you are coming in the morning, the same density of carbon dioxide is there, and there is low density of oxygen. And once you are entering the car during this January, December, you will keep all the doors tight. Inside your car also, lot of deficiency of oxygen will be there, and you are kicking the car. Once you are kicking the car, again deficiency will be more in your car. So please, once you are kicking your car, starting your car, make sure that either you keep open your driving seat door so that enough air is there, and immediately once you are going outside your garage, make sure that little space, cross ventilation of air is there, so that inside your car the density of oxygen is not low. Otherwise, cases are there that in garage people, they have started their car where all the window and door were closed and they fainted. Also, some whole family, they were sitting in car and closing all the windows. They are fainted and some they died. because of hypoxia condition. Their whole body was without oxygen, in muscles, blood everywhere. And one condition is very common. Many cases are there. Some people who are not well educated to understand the carbon dioxide, carbon monoxide, and oxygen density, they will put the heater in their airtight room. They will put 2 heaters on. And in the morning, the whole family who are there, 4 5, they are dead. Because there was no enough oxygen, and it was consuming lot of oxygen and producing carbon monoxide, carbon dioxide gas. So these are all very important conditions to check and balance the oxygen, and always you should be in the area of high oxygen density, oxygenated area, and avoid the condition of hypoxia. Means oxygen plays very important role. And if oxygen is not moving in your whole body from bottom up to head, you are in trouble. So that is the main reason of fainting. I am just going to discuss one by one this point. For example, first one, that is ways to stop yourself from fainting. That condition in medical term is called syncope. Number one, that is called transient loss of consciousness. Second, your BP is not low. Monitor always. Always you monitor your BP that it is not low. Means your lower is 60 and upper one is maybe 110. If it is 90 or 80, your upper one, the maximum one, and lower is less than 60, 50, you are having low BP. Please modify your lifestyle once you have low. The mercury level, that is less than 60 and less than 100, upper and lower case. Number 2, 3, learn to do isometric counter pressure exercise. Isometric counter pressure exercise is very important to everybody, whether one is senior, junior, young, whatever, male or female. And that is isometric counter exercise. Pressure exercise means, I have already told you, as a medicinal chemist, professor of medicinal chemistry, we have 3 hearts, from where the pumping of the blood is there. One is here, one is in feet, other one is in calf muscles. Even there is a pool of blood in your thigh. Thigh is the biggest portion of muscles of your body. So there are lot of pool of blood is there. And if that is squeezed by this exercise, that exercise is called isometric counter pressure exercise. I am going to show you the image of that exercise. That exercise is very important. You have to, turn your knee and leg and squeeze it. I am showing it. Okay. Here I am showing very clear picture of isometric counter pressure exercise. Means where your calf muscle, your thigh, and your feet all are squeezed, so that the pool of blood, what it is there, it is pumped from down upward to your heart side. And this is miraculous exercise to get away from fainting, and you practice regularly every day. This is also called, even the cardiovascular exercise, some cardiologists, they will also recommend. This is one of the best exercise for your blood circulation, where the oxygen can be circulated throughout your body from bottom to top. And this is called isometric pressure, counter pressure exercise. Very, very important. Every day you must practice this. This image, it is called counter pressure stocking dress. And that dress, if you are putting tight to your thigh, to your feet, to your calf muscle, it will squeeze the blood. And that also helps a lot for those people who are having a regular tendency of fainting. It is going to help a lot. Now here I am showing oximeter. In that oximeter on the screen is very clear number is there, that is 97 and 60. 97 means that is the oxygen saturation in your red blood cell, and 60 means that is the heartbeat per minute. Here I am showing the oximeter, what? My personal one. Every second, third day, I will check the saturation of oxygen in my blood. So what I will touch it, it is on, screen is on, and then I will put my finger here where there is red lightning here, and just after few seconds, the reading will appear, and then it will show. Here it is showing 98, my this one, and the other is around 100. So this is oximeter, and which is very, very important to use. So here I am showing very important systolic blood pressure, that is 120, we call it maximum, and the minimum is, that is diastolic, that is 80, and it should be there and maintain. Of course some plus minus there, but this 120, if it goes up to 140, something like that, definitely it is high blood pressure. And the lower one, if it goes more than 80, maybe 90, it is high blood pressure. And the same thing is like low blood pressure. If suppose 120 is coming down below 90, and the lower one goes down below 60, maybe 50 plus, definitely you are having low blood pressure, and you have maximum chance of fainting or transient unconsciousness. So this oximeter is very simple computer device, and I wish that in every house we should keep it, and every day in the morning or evening, anytime, you just check the saturation of oxygen. If it is 97, 98 is okay, but if it is below 90, something 80 like that, it means your blood saturation is less and there is emergency. Then number 4, where compression stocking. I have already shown you the address in, from thigh to feet. That is called compression stocking. That dress will squeeze the blood from your thigh and calf muscle and feet towards heart side and brain side. Number 5, measurement of oxygen saturation in blood by oximeter. That I have already demonstrated it. That should be around 97, 98. That percentage of saturation. Number 6, hypoglycemic condition. Hypoglycemic condition means you are suffering from low density of glucose or sugar in your blood. It shows that enough sugar is not reaching in your brain, and that is also responsible of getting fainted very quickly. And then number 7, anxiety development. Once you are having anxiety, actually anxiety control is very important. Once you have anxiety, definitely you are at risk, because anxiety is going to reduce your blood flow to your brain, and you will be in depression. Number 8, vitamin D deficiency. Vitamin D, I am always mentioning, that is sunshine vitamin. It has multi-purpose. Lot of help. Most of the problem, allergic or immunities, and even the blood oxygen level, all are associated with deficiency of vitamin D. At any cost, make sure that your body is not having deficiency of vitamin D. At least in the morning you can sit in the sunlight, and also there are different food material, they are rich in vitamin D. You can take all those food material. That is with a reduction, that is systolic BP. If you have deficiency of vitamin D, there will be reduction in your systolic blood pressure. Systolic means that is 121 will be reduced to 100, even 90. That means towards low blood pressure, and your brain will not get enough oxygen. Number 9, potassium. Potassium decline in your body can cause fainting, and that is very important to take such type of food which are rich in calcium, like one is banana, then some cabbage, cauliflower, also avocado. So all these fruit and vegetables are there, you can take. And then the last one, that is called medication. Medication means some tablet or capsules are given by the doctors, and that capsule or whatever medicine is given, that is for just to trigger, activate adrenal gland to produce more and more cortisol hormones. And those cortisol hormones, once more is produced, it is going to help your blood pressure, your carry of oxygen to your brain. So that is type of medicine is given, and they are mostly steroidal to boost the hormone level in your body. So here in treatment, in medication, we have to take care of general as well as steroidal medicine, that is cortisol. And that cortisol steroidal hormone is produced by adrenal glands, and if enough steroidal hormones are not produced in your body, there is chance of fainting. And in the case of female, always there is more heartbeat, and because of that there is a little bit more BP, different from a male, because the heart of the female is smaller, little bit smaller than male, and to match the output of the blood like male, the female heart has to beat more to pump, because one beat is pumping less because the size of the heart is little bit smaller. That is the main reason. That's why for female fainting we have to consider this factor of the small size of heart. Medication, the most common drug what it is given for this treatment is how to increase the blood pressure, because generally those who are having low blood pressure, this type of condition, that is fainting, or that is called syncope, and other, that is transient unconsciousness, is common, and they are giving the drug. One drug is called midodrine, and other one is called fludrocortisone. Fludrocortisone is a steroidal drug, and they are used to treat low blood pressure. Corticosteroid. Corticosteroid is produced by the gland that is known as adrenal glands, and these adrenal glands, they are producing enough steroidal hormones, and if there is any hormonal problem, because of that, if any disorder comes like fainting or some other things, means that adrenal gland is not properly functioning and enough steroidal hormones are not produced, and that steroidal hormones are, that is called cortisol hormone. It may cause fainting. Female condition, because of smaller hearts in female do pumping less blood per minute, with each heartbeat need heartbeat faster to match male heartbeat output. So with this I will stop. Thank you very much for watching the lecture, and in the last but not least, please regularly go on checking your BP, your sugar, and your oxygen saturation level in your red blood cell, whether oxygen is reaching from bottom to top or not. Once again, thank you very much for watching the lecture.